All right. Hi, everyone. Thank you all so much for joining us. Welcome to Northern Now, the digital event series presented by NMU Alumni Relations for alumni and friends. My name is Kylie Bunting. I am the digital engagement architect of alumni relations here at NMU, and I'm really excited that you have joined us tonight for this panel discussion. We're really excited to continue the series and share some insight from a panel of experts in rural health. First, I just want to cover a couple of logistics. While we are unable to see and hear you during this webinar format, we want to still hear from you. So if you have any questions, I will be monitoring the Q&A function. So please send your questions for our panelists there. And also use the chat function to chat with your fellow alumni and friends who are also joining in on the webinar. A little note about that. In the chat window, there's a drop-down menu that says to send chats to hosts and panelists or to everyone. Make sure you change that to everyone, otherwise the messages are just going to go to those of us who you can see on the screen and not to everybody else watching. A couple of upcoming events to note. Northern Now takes place the second Wednesday of every month. In March, we're partnering with NMU's Art and Design Department to hear from students, alumni, and faculty of the program. Then in April, we're going to be joined by motivational speaker, author, and TikTok influencer, Mylan Murphy, who's also an alum, for a family-friendly book reading. And then some other events, just to note too, we are having an alumni night at Little Caesars Arena for the Detroit Red Wings versus Columbus Blue Jackets game on April 9th. The special ticket offer includes a discounted ticket to the game, a limited edition, really awesome Red Wings green and gold beanie, and also a gift to NMU student scholarships. You can purchase tickets to the alumni game at Detroit right now on our website, and more information on the other events will be made available soon too. So keep up with things on our website. Also, just a little save the date. Homecoming is September 23rd and 24th of this year. So save that date and join us for some fun activities. More information will be coming as well. I also just want to take a quick minute to mention Wildcats Connect, which is a platform for alumni and students to ask questions and offer advice. It's really a great way to help out NMU students, a great way to stay connected to the university and get in touch with fellow alumni. So please make sure you utilize that. More information is on our website, and you can sign up for that and start joining in the conversation and network with your fellow alums. And last but not least, don't forget to follow us on social media. You can find some success stories, keep up with other alums, keep up with the university. So keep in touch with us that way. And now I would like to welcome our moderator for the evening, Elise Burr, who's the director of the NMU Center for Rural Health. Welcome, Elise. Thank you so much for being here with us.
Thank you, Kylie. Real pleasure to be here tonight to moderate this evening's session. We have some great panelists. We're going to talk a little bit about social determinants of health and what that means, and an occupation that's fairly new, that is community health workers. They've kind of been in the field for about the last 10 years or so, and we're going to talk about their influence in our region area in the Upper Peninsula, Michigan. So happy to be here. Just wanted to say a few notes about the Center for Rural Health. We've been around for about 1.5 years now. Our focus is to improve the health and well-being of Upper Peninsula residents, and thrilled to be engaging Northern, I guess, from a regional perspective and taking a look at the challenges and potential solutions for our area. So really hope to hear from people tonight, questions they might have about social determinants of health. What those are is actually, it has to do with the environment and the things that impact our health and our well-being that we experience on a daily basis. So it's a combination of things from our environment to our social networking, to our communities, to food, everything from housing to the resources that we need to live. And when you live in a rural place in America, you have challenges with some of those. And regardless of where you live, it can impact your health. And so what we're going to be talking about tonight is how the community health worker actually helps to break down some of those barriers to care. So I'd like to introduce our panelists tonight. We'll start with Shannon. Shannon Lieski is a principal of Everyday Life Consulting, and she's an agency that focuses on the development and the training of community health workers. Welcome, Shannon. If you would like to just tell us a little bit about yourself.
Yeah, thank you for having me, and good evening, everybody. So Shannon Lieski. I am a Michigan native, although I live under the bridge at this point in my life, and I've been working in the field as a community health worker and also as an executive for about 20 years now. And so it's a really influential field. It's really meaningful, and excited to share more about it tonight.
Thank you, Shannon. And I'd like to introduce Alizar. Alizar Croman is a local community health worker right here in Marquette. Alizar, please give us a little bit of information about yourself.
Sure, thanks for inviting me to participate in this, Elise. As Elise mentioned, my name is Alizar. I am a community health worker. I've been doing this work for about 2 years, first with Upper Peninsula Health Plan, and then since this past summer with UP Health System, Marquette and Bell. I am not a Michigan native, but I do live on the right side of the bridge, at least. I grew up on the West Coast. I've been here since 1996. It wasn't a planned move. I came to visit my grandmother in Marquette and to spend the holidays with her, and I kind of got snowed in, and so I stayed. Prior to working as a community health worker, I worked for a few years as a certified peer recovery coach, working with folks with substance use disorder and alcohol use disorder challenges. So again, thanks for everyone for attending, and thanks for letting me be a part of this, Elise.
Thank you, Zar. Happy that you decided to stay with us despite the snowstorm that you experienced. And last but not least, Sarah Monty. Sarah she's a graduate of Northern, and she's the outreach director for Marquette Food Co-op. And Sarah, if you'd like to give us a little bit of information about yourself.
Yeah, so clearly not a community health worker, but still got invited to this panel. Co-ops all over the country do a lot of work that intersects with community health, whether that's supporting projects financially or providing educators. So in this case, I actually started as a teacher here at the Marquette Food Co-op doing food and nutrition education for the community, and moved into the outreach position later. I also am part of the UP Food Exchange, which works to support local food systems and local food work all across the Upper Peninsula.
Thank you, Sarah. So I'll mention as we get into this discussion tonight that I am pretty much working with everybody on the screen on some different initiatives in our region related to community health workers, as well as an example of food insecurity as being one of those social determinants of health that we'll talk a little bit more about tonight. So Shannon, if we can start with you, if you can provide us some information on community health workers and what that profession looks like.
Yeah, so community health worker is a skilled trade classification. So it is a profession that has been in existence across the world for actually over 100 years, but newly emerging and newly getting a lot more attention, especially in Michigan, for about the last 10 years, as Elise had mentioned. It's a great field of work. Our community health workers are essentially a frontline public health worker. One of their unique things is their ability to connect authentically with the community that they're serving, often through lived experience. Most of our community health workers do tend to be female, although there is a new emergence of males, as we will need when we talk about having a peer-to-peer connection and having lived experience in similar backgrounds. And they're most skilled in kind of that service navigation. So our food partners like Sarah are people that we work with regularly.
Thanks, Shannon. Zara, can you give us a little bit of information about your work and the impact that you have here locally in Marquette with your projects that you're working on?
Sure, I'd be happy to. In terms of impact, when I hear that question or saw that question in the script, I thought of, like the pebbles that you throw into the body of water and the ripples going out. And I just feel like every time I'm able to help a person that I'm working with, a client or patient, person receiving services, whatever we're calling them, that I'm moving that person a little bit closer to, and sometimes a lot bit closer to, what I think most people really desire for themselves, which is wellness. in body, mind, and spirit. And so I kind of look at every little win with an individual client as a win for community health workers in general, because I really think that, these successes with folks receiving services can and will help to create and spread awareness of the role that community health workers can play in a person's journey towards well-being. And I think that creating more awareness will likely help create more opportunities for community health workers to provide services to members of, our communities. I really think that the best advocates probably, or some of the best advocates for this type of work, are folks who have received services from a community health worker themselves, and then the assorted witnesses who have seen the benefits of working with a community health worker in their patients, their relatives, their friends and neighbors, etc. So it feels sort of like a grassroots thing at this point. It's growing, I get that, but I really think of it, in terms of the impact it makes on the community, or can make on the community, in terms of just starting with that one person and helping them with whatever it is that they want help with.
Great. So just to provide a little bit of insight, I guess, to people who are still somewhat unfamiliar with community health workers in general. Previously, I was employed by a federally qualified health center, and we started to engage community health workers in our outpatient clinical setting. And so what would happen is we would have a patient present for their appointment, and we would look to identify additional needs that they may have that they don't register as coming to their appointment for. Like if they're coming for an earache, for example, where is it appropriate to find out that maybe they're having difficulty securing food, for their household, or maybe they're challenged with transportation to get to and from their appointment. And so at that time, we had started to identify some of these additional needs that patients might have. And as a result of connecting people with the resources that were in the community, it not only helped improve their health, but it also increased the number of patient appointments that people were actually showing up for. And we had a decrease in no-show appointments. I think it's really important that the community health worker was somebody that the patient could relate to. You would find it sometimes more challenging for a patient to talk to a physician about a need they might have for fear of being judged, or for fear of, just looking like they're not equipped to either be a parent or as a person, as an individual. And so this community health worker, it really had removed barriers, and they allowed people to talk to people from their community who they could relate to, and then kind of develop this bond. And it was really important. We saw the impact that it had. And by far, it was great to be able to connect people with those resources and really identify those additional needs that they have. Sarah, so when we think about some of the, food being one of those areas as a social determinant of health, can you talk a little bit about the food insecurity in our region?
Absolutely. And I will try to be brief, but I do see in the chat that there are folks that are joining us from quite far away. So I do want to make sure to paint a picture of what this looks like. Food insecurity is a huge problem in the Upper Peninsula. Data from Feeding America West Michigan shows us that the average of food insecurity is between 14 to 15% across the UP. It does vary a little bit by county. And the community health needs assessment that was done in 2018 shows that as far as the poverty level goes, the averages in the UP tend to be a little bit higher than the state average for poverty, with children, for example, 10 out of the 15 counties of the UP show that children, 10 are above the average for children living in poverty, which of course we know is going to translate to food insecurity. We lack a lot of key components that would help assist to address this issue. First and foremost being infrastructure. So when you think about where the UP is located, we're the end of the line for any trucking route, whether that's a regional or national system, or whether we're talking about charitable food distribution as well. The trucks are coming from elsewhere and they're backhauling empty, which makes it extremely expensive for them to haul to the Upper Peninsula. We also have the problem of having not a lot of people who are widely dispersed in very small communities. which also makes the distribution of food very difficult. Again, whether you're talking about for-profit hauling or for charitable food distribution, both of these face the same barriers really with this cost of distribution. We also have issues with food literacy and need to do more to educate across the UP about what resources are out there to assist people. Just to put this in perspective, again, Feeding America West Michigan has found that even though the majority of the people who visit their mobile pantry units are eligible for SNAP funding, something more like 27% are using SNAP funding. And they're saying up to 73% of the people that are using it could be eligible to receive SNAP benefits. So not only do we need to let people know about those resources, but we need to get people excited to use that food and do more to help support cooking education across the UP. The other issue that we have is a lot of times when people are working on food insecurity, they will again look to see how can we bridge the gap between things like local food work and farmers markets versus that charitable food distribution. Well, in the UP, we do not have a lot of farms that are producing a large amount of food to do things like gleaning programs or to easily sell to schools so that children would have access to that really high quality food through the school system. So we do need to keep working to develop an agricultural system part and parcel to our charitable food and how we get that food into institutions. And I can go on, but I'll leave it for questions and to talk about more as a group as well.
Well, I'm glad you brought up the benefits, like the SNAP benefits that aren't being taken advantage of. I've heard in some other community meetings that there's a lot of people that came together that wanted to talk about food insecurity in general. And somebody had mentioned the underuse of SNAP benefits and WIC benefits that, are available to people in the Upper Peninsula. And one of the surprising things was that about probably half the people in the room that were there to talk about food insecurity were unfamiliar with these benefits. They didn't know that they existed. And I just thought, boy, everybody's got their heart in the right place, but to really understand the system, and that's what we rely on community health workers to help us navigate that. I mean, it can be a challenge sometimes. Another area of that social determinant of health is also access to these things, whether it's access to care, access to insurance to get the care, access to food, and so on. Sometimes just trying to fill out applications for housing, those can be really challenging sometimes. So I definitely see the importance of needing community health workers. One of the things that the Center for Rural Health is working to do right now is applying for an application to hopefully become the regional training center for community health workers in the Upper Peninsula. And the goal of this is that people won't have to necessarily travel downstate to get their training. When we take a look at the work that Alizar's been doing, he's actually building a community of the community health workers throughout the region. We want to help to enhance that. Zara, can you talk a little bit about the outreach that you've made with community health workers up here?
Well, yes, I can. I knew most of the community health workers that are working, at least in Marquette County, just based on previous employment and being a member of the recovery community. But I decided, I guess in October, that it would probably benefit all of us folks who are working as community health workers to form some sort of a group. I think we call it the UP-CHW cooperative at this point. And it doesn't exist beyond just literally a Microsoft Teams group and an email chain. But we hope to expand on that, and we hope to include other community partners in our quarterly gatherings at some point to, have discussions, roundtable discussions about ways that we can help the folks we're working with access resources, how we can, support each other in the work that we're doing. It's in its infancy stages, I guess. It got delayed a little bit because I had COVID twice. And so, trying to get together again had to be postponed. But we're looking to get together again, and then try to also, I think it would be good, and maybe you can help me with this, Elise, but to get CHWs in the other 14 counties in the Upper Peninsula involved in this. I don't know, where they are or who they are. So,
Yeah,
maybe. Go ahead.
That's one of the things we'd like to do is kind of just create this regional network. But then this example of bringing community health workers together, even though they all work for different agencies and different hospitals and everything, they all have one common denominator, right? And that's helping people. And so it's great to be able to connect them kind of as a strengthening support system for themselves as well, to be able to network and understand the challenges they might be facing in their field. My hope would be that if we do receive funding to become a training facility, that we'll be able to even start collecting that data from the community health workers, so we can go back and track what resources are we connecting people with and what geographic regions. And it's not enough, in my opinion, to just connect them, but then to take that information back to our community leaders, to our legislators, and say, this is what we're seeing in different pockets of our Upper Peninsula. What are we going to do about this? How are we going to address these needs in our communities? To really try to get ahead of this, versus being reactive to it and taking a proactive type of look.
Elise, we have a question that came in. What organizations are currently hiring for CHWs here in the UP? Do we know any offhand, or does that need to be?
That is a great question. Currently, the organizations that I'm familiar with that have community health workers right now are the Federally Qualified Health Center, Upper Great Lakes Family Health Center. They currently have 2 community health workers. As Zara had mentioned, UP Health System at Marquette, Bell, and Portage each have a community health worker. That's been a more recent development. Typically, community health workers have been at outpatient clinic settings. So this is the first time in the Upper Peninsula that they've been integrating them into a hospital system. So it's kind of exciting because there's just a wide variety of what community health workers could be doing at a number of different levels. There are also community health workers who are working at Upper Peninsula Health Plan, at UP SAIL, Superior Alliance for Independent Living. And they have engaged community health workers at North Care Network in Marquette as well. But I will say, I can definitely see a need. Not only will we be educating hospitals about how they could use community health workers, and how it can impact their patient population and the health and well-being of people, but I see the community health worker as something that could be expanded beyond the medical setting. I think that, for example, if we do get funded, I would love to integrate a community health worker here on campus at Northern. I think that if we can identify these needs of our student population and meet these needs, that it's also kind of a social determinant to education just as much as it is health. And so what would providing these resources and connecting our students do to help increase our retention at Northern as well? And so if that could be piloted here, I just see a huge expansion of this need. I could see community health workers at libraries and in social settings, just to support us as a society, not just outpatient medical facilities.
Shannon, I was just going to add, if you do a quick search, Upper Great Lakes Health Center and also the health departments are currently hiring. There are many jobs out there. One of the unique things for community health workers is we hold over 150 titles. So it is a job classification that is very complex because of our specializations. As Alazar had led on to, there are these various capacities that we work in based off of our lived experience and our skill set, although we all collectively are community health workers. So many job opportunities out there, and will be many more as the training facility can be localized.
A follow-up question to that, Tracy also wants to know, can this certification be obtained here in the UP? And can people use any of the grant funding through Michigan Works to obtain this certification?
Shannon, would you like to take the first part of that?
Yes and yes. So absolutely. And there's many ways that it is covered. And oftentimes when you work with qualified training organizations, they're going to look for using the funds the best way possible to support the student. But yeah.
Yeah, and the hope is that, you know, if we receive this federal funding grant, then we will be training community health workers throughout the Upper Peninsula. We want to be that resource. We would love to be able to have train the trainers located in different pockets of the Upper Peninsula. We don't want travel to be a burden. We don't want the expense of traveling to be a burden when it comes to training. Just as an example as well, the community health worker, the options that we're looking at for training would be a 6-week session with 2 days a week in person, and then some online requirements for training, as well as an option to have a self-paced online module as well. So, and then the concept behind this is to also continue developing modules to keep people educated about things that come up. For example, 5 years ago, we never would have thought about this pandemic hitting us. So as things rise to the occasion, you know, what additional training and education can we provide to try to support our needs, you know, in the community?
A quick follow-up to that. What is it meant by becoming a training center? So perhaps you want to expand a bit on what you meant by that, Elise.
Sure. So the idea to this is that we want to have individuals housed at the Center for Rural Health here at Northern Michigan University who will go out and train people to become community health workers. So we will provide the actual trainers of that education versus people in the past. It was common for people to have to travel to Lansing multiple times to receive this certification and the education. So not only was it traveling throughout the day to get there and traveling back, hotel expense, gas, food, overnight. We know it's going to save our businesses in the Upper Peninsula money, you know, to be able to provide this training right on site. And my hope is to really go to different pockets of the region and provide that training versus making everybody travel to Marquette for that training.
Another follow-up to that, a guess or an estimate, how many CHWs are in the UP right now? And based on UP population, how many CHWs do you hope to train annually? Perhaps that's based on your grant application.
Yeah, Shannon, you want to talk about the current?
Currently, there's about 10, and the need is 100 times that. We need community health workers, at least one at every frontline organization. The predominant place for them to work are our food pantries, our schools, our health systems. You know, it's numerous. They are the frontline connectors. They are the health equity experts. They help with health literacy. They're prioritizing the social determinants of health, and it's really relational. They're knowledgeable connectors, right? Alazar is a perfect example. He knows his community. He has connections that are meaningful and can have authentic conversations to really get to the root cause issues rather than these kind of transactions. Needing food or an identified need is very different from what kind of food. You know, is it that the food pantries, predominantly in our rural areas, sometimes don't have refrigeration or have the variety of specialized foods for individuals with specific health diets? So the community health worker has those kind of authentic one-on-one conversations to connect with people like Sarah, you know, if need be, to say, hey, how can we get creative and really meet the true need of this individual family unit? And so it's meeting people where they're at.
Absolutely. We actually run a roundup program here at the store that collects money for the food banks specifically to purchase the items that they don't get. And those are often items like things for specialty diets, like people who need an alternative milk and that kind of thing that can be really difficult for people to find in the traditional types of food that are found.
Another question, what can I do to help advocate for access to healthcare in my rural county as a community member?
That's a great question. There's a lot that can be done, but we're taking a look at the different avenues of what to do. For example, I just talked to somebody this evening about oral health and what was happening down in Dickinson County. And so it's understanding sometimes where legislation fits with our needs. We're in a health professional shortage area, so we have challenges with recruitment and retention. I think we need to look at initiatives that are going to help us maintain our current workforce, but also recruit additional workforce. And sometimes that's just a matter of education and different communities kind of coming together. When I take a look at what's happening with, like, say, ambulance agencies right now, that's a huge challenge in the Upper Peninsula. It's a profession that is not recognized as an essential service like fire and police. And so, you know, that's bigger than all of us. That goes back to a legislative funding type thing. So how do we get together as a community and help move the needle on that? So it's really looking at a lot of these different components. Community health workers will assist people with accessing insurance so that they have access to healthcare needs. And so that's why I really think helping to build out that community health workforce in the Upper Peninsula is going to increase access to care. One of the challenges that we'll have before us is actually convincing employers about the importance of the community health worker and how they can impact. So as we develop and hopefully turn out, you know, people who are certified as community health workers, we'll get the employer force or the workforce to actually support these individuals in our communities.
I was going to add in, when you talk about policy or what you can do to support it, it sometimes is as simple as the HR practices. I can't tell you how many HR reviews I support as a stakeholder for community health worker programs, both in Michigan and nationally, that require a bachelor's degree. I can tell you in 99% of the time, you're probably not looking for somebody with a bachelor's degree, although they might have it. That shouldn't be the first initial mark. You know, our individuals that are certified as community health workers, that is their certificate, that is their trade, no different than an artist or a welder, etc. So making sure those policies at the local level aren't prohibiting or screening out who we're actually trying to fill in these fields. Policies that support lived experience. Lived experience should have merit and value just as much as our learned intellectual experience through formal education. The other piece, you know, COVID's probably the biggest missed opportunity I can say for Michigan when it came to community health workers. We didn't fight to get legislation for our frontline workforce to be counted in. Many states did. And so that COVID funding that came for the frontline workforce and the vaccine outreach went specifically to community health worker organizations. And in Michigan, it did not. And so those are things that when you look at the bigger picture, if we want to strengthen the frontline public health workforce, we have to be really specific and intentional on who those people are. Yes, we need public health educators and we need nurses and we need social workers, but we do also need to support our community health workers.
Yeah, and you know, another really simple thing I think that people could do to really help with legislation and advocacy work is we have to do a better job about telling our stories. You know, not just stories that indicate our need, but our success stories and how that, you know, how that relates to our lives. And our legislators, I mean, that's what they want to hear. I mean, they don't necessarily want 20 pages of language that's over their head. They want to hear bottom line in the trenches. What are you going through? What can I do to make a difference for you? And so, you know, one of the things I'm trying to work on is writing these blog stories with not only our healthcare professionals throughout the Upper Peninsula, but also our patients and what they're experiencing, and just trying to actually record some of these, you know, stories to be able to share with other individuals who are helping move advocacy and legislation on healthcare initiatives. I did notice that there was a question about Michigan Works involved with this, and I will say that this particular grant that we're working on, it's a federal grant. Michigan Works is one of our top partners. We have 9 partners throughout the state on this grant application. And so Michigan Works would be assisting to be able to advance the community health workers in our region.
Great. Are there CHWs in the emergency departments?
Sir.
Well, there are now. I've been spending time at the emergency departments in Ishpeming and Marquette frequently starting about a month ago. Molly Wales, who is our other community health worker and the program supervisor, and I kind of switch back and forth. I'm at the ED in Marquette this week. She's at the ED in Ishpeming this week. So it's good to be there on site. That'll hopefully lead to more initial engagements face-to-face with people rather than by way of cold calls or, you know, flyers that we're sending to people. We're still working out some kinks as far as the logistics of us being in these EDs, but we're making progress and have, each been able to engage with potential program enrollees while they're there in the hospital. So we're moving in the right direction.
Great.
That's great.
Once someone has been a CHW for a while, how do they advance or grow in their career? What continuing education is required? Perhaps
Shannon, do you want to talk a little bit about pipelines?
Yeah. So the kind of national rule of thumb recommendation is between 10 and 20, what we consider like continuing education units per year in the variety of topics, right? We want our community health workers to be well educated and knowledgeable in very practical things to their day-to-day work. So the nice thing about it is it's not super rigid. It needs to be comprehensive and broad. Could even include topics such as self-care, things like that that are going to be important for their career pathway. Yep. The other piece too, as we talked about emerging fields that I think it would be important to know is that we want to advance the career field. So for someone like Alazar, right, there needs to be established employer-supported pipelines to those tiers of community health work. As you mature in your role and you have many years of experience, an advanced position, a supervisor position, program management positions are going to be really key to help to integrate the work, but also when we talk about policy, you're impacting and kind of embedding those influencers, those knowledgeable people who have been there, done that, and have that experience. Very similar to what you see in hospital systems. Oftentimes the CEO has experience as a nurse or a physician, right? They have that lived experience in the career that they're working in.
All right, this is for anyone. Which skills do you feel are the most important, say your top 3, for higher education programs like college and universities to prepare students to become community health workers?
Empathy, and relationship building, listening. I heard once or read once that, and this was in the context of drug and alcohol counselors, but I read that a client receiving services in that context, success could be charted accurately 2 years out from when they, received services based on their clinicians' empathic listening scores. And I just found that fascinating. And this was, whether they were using the same treatment modalities, different treatment modalities, but it really came down to, how well does that clinician listen to their clients. And I really do believe that applies to community health work as well. I would want people who don't know anything about this to know that the experience of a client of a community health worker is likely to be different than anything they've experienced before, in the healthcare or under the healthcare umbrella. And I think that starts with that skill, listening, empathy, building relationships with people. That's by far my favorite part of this job. I mean, there are a lot of things to like, to love about this type of work, but for me, it's easy to identify my favorite, and that's the people that I get to meet and get to know and, develop relationships with and work collaboratively to, first identify some steps that they might take to improve their health or to change the way that they access healthcare and ultimately to improve the quality of life. So for me, it's all about relationships and building rapport and trust with people. I recently had an older woman that I'm working with, she's in her 70s, tell me that she really likes working with me because she never feels like I criticize her or judge her for some of the things that she doesn't feel real proud of. It's just really rewarding to see her opening up and to see her start to trust me and talk about things that are obviously a source of embarrassment and, dis-ease. But it took some time. I mean, we started working together, a couple of months ago, I guess now, and we worked on some things that in hindsight weren't really near the top of her list of concerns. But I think she kind of was testing me to see how I was going to talk to her, how I was going to treat her, what what the dialogue was going to be like, how she felt about me before she started, opening up about things that really make her feel vulnerable, I think. And so that's really, for me, very rewarding to know that people feel good enough about you, trust you enough, respect you enough to talk about things that probably they wouldn't talk to their, nurse or CNA or social worker, because they just haven't had time to spend with those folks to develop that rapport and that trust. So,
one of the other things that we're looking at is what, just because you go through certification or become a community health worker, that could be great education or training for people who are in other positions as well. So when you take a look at the skill set that a community health worker has, I mean, wouldn't it be great if every social worker went through that same training? Or wouldn't it be great if, that was something that maybe our criminal justice majors experienced? When you think of the population who you're working with and assisting on a daily basis, who could benefit from all of these, this type of education, training, and experience from that community health worker perspective? So, Kylie, do we have another question? I want to get to Sarah on a food topic as well. Go ahead.
This is a quick one. Is there a certification? Is the certification a licensed profession, or can the certification carry from state to state?
That's a great question, and honestly, my favorite. So with community health workers, there's a national slogan, "Nothing about us without us." And so there's a national workforce that is very much in support of what we're trying to do here, right? And this work that Elise is doing is the nationally aligned curriculum. It is a certificate of completion that aligns to a registry or a directory. What you're not going to see in any state thus far across the country is a license. And there are many reasons for that, because a lot of the barriers for licenses include background checks. And some of our community health workers are going to have a past, and that's what makes them who they are. So there's a lot of reasons why we don't have those in place, but definitely it's a, what do they call it? Department of Labor, the National Federal Department of Labor classification, and that is the industry standard is what it's considered. Great question.
Thanks, Shannon. Sarah, I want to jump back to food for a minute. When you think about the challenges that we have with food insecurity in our region, can you talk about some of the initiatives right now being explored to assist with relief?
Yeah, absolutely. Let's think about the positive, right? Not just the negative statistics. I think one of the things that's really exciting in the UP right now is that we are looking at non-traditional partnerships to get work done to address food insecurity. So for example, Elise with the Center for Rural Health and I are working on a project along with other partners to do a feasibility study for an aggregation center for food. And this would be a shared use aggregation and distribution center for both local food, regional food, and charitable food distribution, trying to bring all the players together who are normally siloed from one another in their work to sit down at the table and say, how can we share the cost of this? How can we make this feasible to move food to the people who need it in the UP if we work together? We are also going to be looking at the possibility of light produce processing, because again, if we don't have the infrastructure to support the creation of food and give that next level or that scaling up to our farmers, we're always going to be struggling to find enough food to go around for everyone. So this funding for this feasibility study was through the Michigan Health Endowment Fund. I'm going to keep them all straight as I talk about these projects. So I just have to give them credit because we are really excited to get going and begin the work on this feasibility study. We're also working together on a project with Feeding America West Michigan, this time with funding from the Superior Health Foundation, to look at how we can support education right at the mobile pantries. So we are looking at 7 different locations across the UP. Each location will have 3 demonstrations throughout this spring, summer, and fall that teach folks how to use some of the foods that are very commonly found on the trucks that are coming in for this mobile distribution. We understand that sometimes they're going to need more help than that. So we actually are developing a whole suite of recipes. So there'll be many avenues for people to get this, whether that is through the mobile pantry distribution, or maybe through other places in their community that are willing to host those recipes, and through a virtual component. So Elise will be working with folks at NMU to get a few of these demos filmed so we can have them online. And that way, in places where we aren't able to provide that on-site demo, people will still be able to access that food education. Another project that I'm really excited about that's going to span the entire UP is actually through a food as medicine group, focusing right now on prescription for health. So again, Superior Health Foundation has come through with funding to support this project, which has somewhere between 30 and 50 partners working to make this happen right now. But for those who are unfamiliar with prescription for health programs, the idea is that a healthcare professional would be able to refer a patient who is either at risk for or already has a chronic health condition and also has a financial barrier to purchasing the food that they need to stay healthy. When folks are referred into the program, they will actually be mailed vouchers to be able to go to their area farmers market and purchase fresh produce. So it gives them extra dollars to spend on fresh produce. It also will give them access to education. So throughout the year, we'll be having free educational series, sometimes in person, sometimes online, again, to provide that access. And folks can earn extra vouchers when they attend to give them more money to spend at area farmers markets. But we're not stopping there. We're really excited because Superior Health Foundation was willing to support another facet to the project that's a little bit different than a traditional prescription for health program. And what we said is, hey, if we want to make sure that there's enough food at some of these markets, some of which in the UP are extremely small and the farmers need that support, we need to look at infrastructure for the farms themselves. So we are actually doing, through the UP Food Exchange, mini grants to farmers to allow them to either build new or expand their current cold storage. And as anyone who's been in the UP knows, our climate is a barrier. So the more we can do to preserve and store food, to have access to local food throughout the year, the better. And farms here really face a barrier because we are a lower income area. They can't ask the same prices at their farmers markets that many farmers are getting downstate. So the more we can remove economic barriers for our farms, the more food there will be to go around for everyone in the UP. There's a few other really exciting projects that are out there. I do want to give a shout out to some of that creativity with some of my other community partners. I think it's really inspiring to think about how can we use community garden systems, for example, to support access to good food. In the Western UP, they have a really great program called Growing from the Heart, where people can sign on to actually give space in their yard or to grow extra food that will go to people who need it. There's also really cool farm education going on over in the East End at Bay Mills. They have a farm at their college and they do community meals. They do community education. One of my favorites was they actually had everybody come together for a meal, taught them about how to grow their own garlic, had them come out in the field and do it, and sent everyone home with a package so they could plant their own garlic at home. And I think being creative about our food and all the different ways we can source it is going to be necessary in the UP to meet those needs.
Thanks, Sarah. I think those are examples of just the types of programs and opportunities that exist in the Upper Peninsula. That's just one piece of information that goes back to community health workers. So as community health workers learn about these opportunities, they can then help educate the people that they're working with as well. So that's where, like, if ZAR has connections to all these community health workers in the UP, you know, sharing that information in these different pockets is really going to shine some light on it. Plus, then there's the opportunity for different areas to learn about duplicating what is working, you know, and how can they, you know, see the success in one area and make it happen in another area as well. So thanks for sharing some of that. And I guess the last thing I want to say about some of the food stuff that you talked about, Sarah, is that this also goes back to our economy. Like, it doesn't just end with the food. As we engage with farmers and find out what more they can grow, if we had a processing facility in the Upper Peninsula, this comes back to the economy and then strengthens what we're doing up here. And it's full circle from health to the economy to opportunity. And it's exciting to be a part of, seeing that happen.
All right, we still have some more questions coming in. This is awesome. I love seeing when people are interested in this topic. We'll try to get to as many of these as possible. Elizabeth would like to know, would the training certificate through the Rural Health Center also be an NMU credential? Would initial modules or CE units include course options at NMU?
Well, I'm going to have to defer slightly to Shannon on this, because Shannon is the consultant that this grant will hire to work with me on this over a 3-year period. And we have to work out some of the logistics yet. So Shannon, I don't know if there's more you can add to
I've been
that.
reading all the chat questions.
I'm afraid to commit to certain things yet.
No, it's the design process, right? And everybody's going to be involved. And there's a lot of questions that have been asked that I absolutely can answer too. There are many examples of this, I could say, both in Michigan and outside of Michigan. So downstate, we are the NCHW, which is the certificate you guys would be administering right now, is recognized at Mid-Michigan Community College in their Associates of Public Health, and then Central Michigan University recognizes it as 1 credit to go into their Masters of Public Health. But when I say design, I think of other states that use the same curriculum and they've made it more comprehensive and done a larger practicum. And so it's worth more credits, and it's more of a focal of some of their associate degrees and or master programs or continuing professional ed. So lots of opportunities, but we'll remain in the design phase and kind of just take it 1 step at a time. But I love the excitement. I love the questions, because it's exactly, I think, what I at least was hoping for. The connection with home care, we get asked all the time about nurses, home care, health educators, social workers, all very complementary. So direct support workers, direct care workers, direct support professionals. There's a lot of momentum in Michigan right now with that. And yes, they absolutely complement one another. It comes down to the finer details of the day-to-day work. So when we talk about, is it like a community health degree? It's not. I have a degree in community health. It's very complementary and it's been very helpful, just like if I had a degree in social work, but the actual skilled trade and field of work and the training for it is extremely specific, and the day-to-day looks very different. And I can always lean on Alazar to kind of speak to that. And I know there's been a few one about Michigan Works, a lot of excitement for Michigan Works. They're absolutely involved. They're involved in the UP, they're involved in Lower Michigan. I had a presentation with the Northern Consortium today in the lower part of the thumb. And so they're definitely there. They understand the value. And there's a lot of us advocates trying to help to understand, or educate rather, the community at large of this is an opportunity, right? This is an emerging workforce and we need a lot of bodies to fill it. And it's a very successful career.
I got to say something funny about Michigan Works. I had a great meeting with them yesterday because they're one of the partners on this grant. And by the time we got done talking about the education and the training for community health workers, the person was convinced that they needed to have their staff go through this training as well. So I just thought that was great, that as they learned more about it, they could see how this could help, the work that they do as well.
We have 6 in our cohort right now from 5 different Michigan Works in Michigan.
That's great.
It's their staff. Yep.
Someone would like to know, Kurt would like to know, are you working with any nonprofits to support your work? The one in Michigan that comes to mind is Hope Network. The CEO of Hope Network is an NMU alum.
I'm not familiar with Hope Network, but would love to engage with them, and learn more about them.
I've worked with them. There's about 50 nonprofits in Michigan alone that have sent individuals to training. And so it's very popular and, again, emerging in that workforce. There tends to be a high turnover in our frontline workforce, especially at nonprofits for various reasons. And so what's nice about this certificate is as portable as it is. You can take it and go work at the next one, where when you go back to some of the comparisons with the direct care workforce, one of their biggest limitations and challenges that they face in sustainability is often that training is employer specific. And so it's not portable. And so it's one of the biggest emphasis I can say with community health workers is Alazar can work for the Rural Community Health Worker Network. He could work at Hope Network. He can work at the hospital. He can take that certificate anywhere.
Someone asked, is Superior Health Foundation based in Marquette?
Yes. That was an easy one. I like the easy ones.
Yeah, I know. I'm like, I think I could even answer that one, but I didn't want to be wrong. A lot of people saying super excited that I zoomed in for this. Someone, Tracy says, I'm not even working in this space anymore, but just really passionate about rural healthcare in the UP. So awesome. Love hearing that. That's it for the questions. So we have about 5 minutes left. So Elise, I'll let you ask any last minute questions and have anybody chime in on anything that they feel like we have not covered yet.
Sure. I would like to pinpoint Sarah for a moment. Sarah, as you received your education at Northern Michigan University, knowing that we have a lot of alum on our call tonight, I would like to know, how do you think that your education at Northern prepared you for the career path that you've currently chosen? And, is it what you planned to do when you went to Northern?
I have a lot of gratitude to Northern for how they prepared me for what I'm doing now. And it's not necessarily exactly what I thought I was going to be doing. So I had a teaching degree for history and political science. But when you are in a history and political science program, you're learning all the time about inequities out there in the world. It's just, that's what history is often about. And so when I emerged and there wasn't a teaching job readily available in my field, I saw this job doing food education. And I was so excited because to me, food is such a basic right. And it's a huge equity issue that we have, giving everyone access to good and healthy food. And so I was thrilled to be able to take what I was doing and what I learned as a teacher through the fabulous education program at NMU and from all the wonderful teachers in both the history and poli-sci department, and apply that directly in my community. I get to work with all different demographics and not just one particular age group as I would have as a teacher. It's quite non-traditional, but it's still teaching all the time. And I can't say enough about what the education department will teach you for organization. Whenever I work with other teachers, I'm like, yes, they're going to know how to take notes on this and know their timing and all of that with teaching. So, and I also appreciate how much the university has supported me in this work. I know that professors that I've had are getting involved. We do tours here at the store or teaching cooking classes that we're using those links between past professors, and they're passing my contact information on to new professors. We even had someone who said, oh my gosh, I think I saw my history teacher on one of your commercials because he was such a great supporter of the co-op that we reached out to them. So I feel connected even today to the university.
I think, what I've noticed, I guess, with working with all of you is that, I studied fine arts. I was a business, English, and fine arts major and never thought I would be doing this either. But I think about the passion that all of us have about what it is that we do. And what I've noticed is that regardless of other people's backgrounds, you can sometimes spark that interest in people. And having worked with different students here at Northern, I have a business student right now as a grad student working for our department, and he never thought about rural health, and he's just diving right into this and loving every minute of it. So I just think the more that we can have conversations and engage people, with all these different aspects impacting rural health, that it just is going to continue to, kind of like the example you gave, Czar, throwing that pebble in the water and just watching those ripples go out and make that effect.
Awesome. Does anybody have any other, Shannon or Alazar, would you like to any closing comments before we wrap up here? We've got 2 minutes. Might as well make the best of it.
I'm going to defer to Alazar, and thank you so much for all the work you're doing, and thank you for having me today.
Well, looking towards the future, I guess I'm really hoping for increased recognition for the work that community health workers do and can do in the communities that we serve. And I hope that colleagues of community health workers and, various community partners can and will join us in promoting the expansion of the workforce, to keep this momentum that we've got going in Michigan, to keep it going and to get 10 times the amount of community health workers that we've got working in the UP, recruited, trained, and out there working, helping people. So, if you know of a community health worker, or if you're aware of, any of the work that we're doing, which you all are at this point a little bit aware, please talk about it. Please spread the word, spread the message, be little A's or little advocates for us community health workers, please. And thank you.
Amazing. Also just want to mention you can follow the NMU Center for Rural Health on social media, stay updated on everything that they're doing, all the amazing things at NMU Rural Health on Facebook, Instagram, and LinkedIn. There's also, as Elise mentioned, the blog stories on the website too, and hear from regional healthcare community on different topics too. So feel free to check that out. I will be sending a follow-up email tomorrow, and I'll include all of that information. In addition, if you have any follow-ups, you want to make any connections or anything, feel free to reach out to us at alumni@nmu.edu, and I can get you connected. Or if any questions pop into your head later too, I can always connect you with Elise, Shannon, Alazar, or Sarah as well. I want to thank all of you for joining us on this panel and all of you for tuning in. This was a great conversation and obviously something that we need to explore even further. So we look forward to continuing this series next month. Keep up with things on nmu.edu/alumni. I'll be sending out a short survey for you all to complete tomorrow, so you can tell us how you liked the event and some topics that you might want to hear about in the future. I'm also going to be choosing one winner from tonight's attendees to receive a free alumni t-shirt. So make sure you keep an eye on your email for that too. As I mentioned, connect with us via email or on social if you have any follow-up questions or would like to be connected with any of our panelists or with the Center for Rural Health. Keep up with us on social media too. Thank you all so much for joining us, and we hope to see you all again soon. Thank you.
Good night, everybody.
Hi, everyone.